Yeah.
People can live for years with dialysis, and if there's anybody who can get a transplant done, nothing like it. If I had somebody who told me about this, I would have been at a better place when I started going for dialysis. So for me, this is like an outing. I've treated it like an outing.
Yeah.
So I don't
That's a
think I
very
would,
that's a very
I don't know.
positive way of looking at it.
Yeah, that's the only thing left for me to
Yeah.
do. The first thing is to learn to accept the fact that they now have a disease which can be cured, at least maintained. They don't need to lose heart
Yeah.
or lose willpower. Like, since even it took time for me to adjust to the fact that I've never been ill, I've never been hospitalized before. But due to this, now I'm visiting the hospital every week, thrice a week, I
Yeah.
guess. Yeah. And you have to learn to accept the fact that there's nothing, you haven't done anything bad. Disease was diagnosed in July 2020 when suddenly I felt a lot of, I felt weakness, lethargy, and I had lost almost around 30 kg of weight. This happened during a period, it took around 1.5 years. Like, for 1.5 years, I didn't feel hungry at all during nights. So tea was the last meal I had. Like,
Yeah.
my legs felt weak. I couldn't stand. I couldn't sit. So then I realized there's something really wrong with me. So
Yeah.
I went to the nearest CGHS dispensary and he asked me, "Ma'am, क्या लिखना है?" I said, "Sir, आप सारे टेस्ट लिख दीजिए. I'll go and get checked." Since I had been working on the medical seat for 5 years, I could make out that there was something wrong with the report because my creatinine was 12.5, hemoglobin was just 6.5. So I knew that
Okay.
there's something terribly wrong with my kidney.
Yeah.
And, but I thought like medication would cure it. I didn't
Okay.
realize that it had to be dialysis. So then from July 2020, 2 dialysis per week started. I was getting treated in Dr. B.L. Kapoor Hospital.
Okay.
And then uh, over a period of 1 year, it went on quite okay.
What the cause was for your kidney problem?
I had severe, what you call, osteoarthritis. My right knee was
Okay.
swollen. And for that, I took painkillers.
Yeah.
My doctor
Yeah.
prescribed painkillers for 10 days. But since
Yeah.
I like the idea of having a painkiller and going to office, I continued it
Yeah.
for more than a month. It was a
Okay.
pink
No.
tablet. I'll definitely try to, some kind of Meftal. I don't know,
Meftal. Okay. Yeah.
Meftal, yeah.
Okay.
And so then they came to a conclusion that my CKD was because of over medication,
Okay.
painkillers, which affected the kidney, and I'm stuck with it now.
And what support do you have for yourself at home, or in the community or at the office?
Now, office people have supported me really well. Like twice a week, I leave office half day at about 11:30 to come for
Okay.
dialysis. And
Hmm.
earlier, I used to feel so tired that I was not in a position to go back to office, even just to
Okay.
sit. I used to
Yeah.
drive back home or take a cab
Okay.
and go back home. Now,
Okay.
so they know my problem.
Yeah.
So, and they're quite considerate. And at home, I have my 2 daughters, grown up girl.
Okay.
It's okay. I do feel tired after the dialysis, but I'm able to go to office the next day.
Acha.
And I can go to office on the way back also.
Hmm.
And it's okay. But there are means to maintain the disease. And I think more than the person himself or herself, the family should be educated. This is not a deadly disease.
Yeah.
So I think that
And if
confidence has to be given to the patients also.
exactly, and if the family members are aware that it's not just my mom or my dad who's got it, it's crores of people in India who've got
Yeah,
kidney disease,
right, yes.
then I think you also as a patient would feel more confident that I can manage this better now.
Even when I used to come for dialysis, nowadays I don't drive and come. I take a cab and come. I used to
Okay.
drive down to the hospital and drive back
Yeah.
even after dialysis.
Yeah.
So it's just, I think, in the mind. I know I'm
Yeah.
ill. I'm having my medicines. I'm getting my dialysis done regularly. So it's not like the life is stopped for you. You can
Exactly.
still manage your life, but you have to do whatever it needs to be done. Like whatever the doctor says, whatever things you can't have, you can't have. So you have to listen to your doctor.
Have you seen a
Yes.
dietitian, or do you just get to see a nephrologist?
No, actually, when I was what you call diagnosed initially, there were dietitians who told me what to eat and what not to eat,
Okay.
and so I am like, except for a few times when I cheat, otherwise I'm actually following the do's and don'ts.
And do you see the dietitian after that, or is it only once that you've
Mm,
seen them?
no, I actually I have been hospitalized twice or thrice. So every
Okay.
time I get a what you call I'm an inpatient.
Yeah.
At the time of discharge, I get a diet chart.
And how was your experience about the healthcare experience since your diagnosis till now in Delhi, for your kidney disease?
In my case, I think I'm blessed
Yeah.
because one thing, I'm educated and I have the means to go to a specialized hospital, and I don't have to have what you call spend money on it. I'm covered
Yeah.
by the CGHS, or even
Yeah.
otherwise. If I'm not covered, thanks to the Almighty, I am earning enough to go and meet a good doctor. So for me, it's okay. But I think it's not the case for everybody around.
Yep.
Like I've seen
Exactly.
patients who, what you call, who need 3 dialysis a week, but
Yep.
because they cannot afford it, or their company doesn't allow, or whatever, they resort to only two, and then it proves fatal.
Yeah, I think it's a big problem in India. The cost
Yeah,
of
too much
dialysis.
actually. Really,
It's
really.
very expensive for people. Even if you're earning well, I think a cost of 60,000-70,000 rupees a month is quite a lot, just
It
to
is. It is.
get
Yeah.
dialysis. Yeah.
And I think even the patients, even those who are getting the benefit of a panel hospital or a CGHS or anything,
Mm.
they also think कि एक ही dialyzer को, that filter can be
Yeah.
reused multiple times.
Yeah. It should not be used. It should only be
It should
used
not
once.
be. Well, yeah, it
Yeah.
should not be used. So I think that kind of education is also necessary for the patients. कि तो क्या हो
Exactly.
गया? That don't care attitude should not be there.
So, do you think community should be there for dialysis patients? For
I
example, there are
think
a lot of
yes,
cancer support groups. When someone's diagnosed, they can speak to other people, and there
yeah.
should be. I feel there should be something for dialysis
There
also
should
on
be, yes,
platforms
because,
like
yeah,
Facebook.
right, right. This kind of disease is rising rapidly. So
Yeah,
if we have a support group, uh, like people who've been diagnosed earlier, if they had told me what
yeah,
all I have to go through, I think it would have been like I would have been at a better place. Now I
yeah,
feel I can educate people about what they should do and they should not do, because I have had almost 3.5 years of experience undergoing
yep.
dialysis and everything. Sure, we need good people like you to start a what you call initiate a change.
Have you ever thought about home dialysis?
Mm, I was told in BL Kapoor कि आप घर पे भी machine, but that is peritoneal, no? And 6 to 8 hours.
I
This at least I treat it like an outing. Like, and I
yeah,
meet people here,
yeah,
and since I'm very talkative, so I
yeah.
make friends with whoever is doing my dialysis, like
Okay,
the technicians and the staff. So for me, this is like an outing. I've treated it like an outing.
yeah.
So I don't
That's a
think
very
I would,
that's a very
I don't know.
positive way of looking at it.
Yeah, that's the only thing left for me
Yeah,
to do.
I think that's a very good
And
message. If someone's on dialysis, they should think that मैं हफ्ते में 3 बार बाहर घूमने जाऊंगा 4-4 5-5 घंटे के लिए, and it's
बिल्कुल
like
मैं
an
वैसे
outing.
ही ट्रीट करती हूँ. Right, it is
What
an outing for me.
what improvement should be there in kidney care and for patients on dialysis in India as such? What improvements would you like to see?
I think it should, one is the cost thing.
Hmm.
Like this kidney treatment should be accessible to all, no
Yep.
matter uh, what their economic background.
Yep.
And like those who can afford it can pay from their pocket. Otherwise,
Yep.
I think it should be something like the government, like you have the National Medical Services in UK.
Yeah.
Everything is looked after by the government. So I think something
Yep.
like that should be planned here. more education, I guess, regarding the disease, and
Hmm.
not only the patient. I think even the family members, friends, they should be educated about it so that they also
Yeah,
know what do's and don'ts have to be followed. Like you said, a community for what you call kidney patients will be
yeah.
a good idea. If I had somebody who told me about this, I would have been at a better place when I started going for dialysis. So
Yeah.
I don't mind sharing my story. It's good. Like
It's
my daughter keep my I told you my elder one is a psychologist. So she keeps
psychologist.
telling
Yeah.
me, Amma, you also need counseling. So I just smile at her.
Yeah.
She said it's not a joke, it's serious.
Yeah.
You've learned to live with your disease, but there are certain things you can't discuss with us. So you need to share it to like with a professional therapist. So I've been planning to go. I don't know when I'll go, but I'll definitely go.
I think every dialysis patient should have a psychologist or a psychiatrist, because
Definitely.
it's not just the disease of the kidneys or heart, it's also the mind. And if your
Hmm.
mind is
Right.
strong enough, then you can easily fight this disease.
Definitely. Definitely. I'm the one for it.